Identify the chemotherapeutic agent. A. Furosemide. B. Levofloxacin. C. Lamotrigine. D. Methotrexate. E. Gabapentin. The answer is D. Methotrexate. Methotrexate is a chemotherapeutic agent. Levofloxacin is an antibiotic, lamotrigine is a mood stabilizer, gabapentin is an anti-epileptic agent, and furosemide is a diuretic. The oncology nurse cares for a patient receiving internal radiation treatment for cancer. Which of the following scenarios most concerns the nurse? A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. B. The patient complains about remaining on bed rest and asks to stand up. C. The nursing student stands away from the patient while talking to him. D. The charge nurse asks providers if they are pregnant before assigning them to this patient's care. E. The physician performs a physical assessment for 10 minutes. The answer is A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. When caring for a patient receiving internal radiation, the length of exposure to the radiation is a high priority for the nurse. It is important to rotate staff who care for the patient, limiting close contact to 30 minutes per 8-hour shift. Additionally, it is important to organize tasks so limited time is spent in the client's room. Visitors must also be limited. Pregnant women should not be assigned to work with this client. The patient must be on bed rest while sealed sources of radiation are placed. It is also important not to stand close to the radioactive source. Which of the following is not a proven risk factor for the development of oral cancer? A. Excessive alcohol consumption. B. Human papillomavirus, HPV. C. Regular use of alcohol-containing mouthwash. D. Tobacco product use. E. A diet with inadequate amounts of fruits and vegetables. The answer is C. Regular use of alcohol-containing mouthwash. All of the above are proven risk factors with the exception of mouthwash use. Poor dental care, prolonged present irritation, such as excessive flossing, tobacco and alcohol abuse, infection with certain strains of HPV, and an unbalanced diet can increase the risk of oral cancer. Which leukemia is linked to the Philadelphia chromosome? A. Chronic myelogenous leukemia, CML. B. Chronic lymphocytic leukemia, CLL. C. Acute myelogenous leukemia, AML. D. Acute lymphocytic leukemia, ALL. The answer is A. Chronic myelogenous leukemia, CML. The Philadelphia chromosome, which is an abnormality in chromosome 22, is most often found in bone marrow cells of patients with chronic myelogenous leukemia. It may also occasionally be found in acute lymphocytic leukemia, though this is rare. Reed-Sternberg cells are pathognomonic in what type of cancer? A. Non-Hodgkin's lymphoma. B. Acute myeloblastic leukemia. C. Acute lymphocytic leukemia. D. Hodgkin's lymphoma. The answer is D. Hodgkin's lymphoma. Reed-Sternberg cells are the pathognomonic cells of Hodgkin's lymphoma. These are mutated multinucleated B cells with a large amount of cytoplasm. These cells can be present in other pathologies. The diagnosis of Hodgkin's lymphoma can only be made if the Reed-Sternberg cells are in the presence of non-neoplastic inflammatory cells such as lymphocytes, plasma cells, and eosinophils. What protein is found in the urine of patients with multiple myeloma? A. Binns-Jones protein. B. Tau64. C. Albumin. D. Alpha-synuclein. The answer is A. Binns-Jones protein. Binns-Jones proteins are present in the urine of over 60% of multiple myeloma patients. Albumin may be present in the urine of these patients, but it is not pathognomonic for multiple myeloma. Alpha-synuclein is associated with neurodegenerative conditions, and Tau64 is a protein present in the neurons of patients with Alzheimer's disease. What is the most common symptom of Hodgkin's lymphoma? A. Bone pain. B. Fatigue and weight loss. C. Easy bruising. D. Prolonged enlargement of one or more lymph nodes. The answer is D. Prolonged enlargement of one or more lymph nodes. The most common symptom of Hodgkin's lymphoma is the painless enlargement of one or more lymph nodes. Unexplained weight loss and fatigue may also be present, but are more likely to present later than lymph node enlargement. Bone pain and easy bruising are not typically seen. What tumor antigen will be elevated in prostate cancer? A. Cancer antigen 125, CA 125. B. Tyrosinase. C. Prostate-specific antigen, PSA. D. Alpha-fetoprotein, AFP. The answer is C. Prostate-specific antigen, PSA. In prostate cancer, patients will have elevated levels of prostate-specific antigen, PSA. Cancer antigen 125, CA 125, is elevated in ovarian cancer. Alpha-fetoprotein, AFP, is elevated in hepatocellular carcinoma, and tyrosinase is an enzyme that is often highly elevated in malignant melanoma. The oncology nurse cares for a patient who has been newly diagnosed with leukemia. Which of the following sets of symptoms would the nurse not expect during the initial physical assessment? A. Mouth ulcers, low leukocyte count, weakness. B. Throat ulcers, pneumonia, anemia. C. Lethargy, bleeding gums, petechiae. D. Headache, ecchymosis, retinal hemorrhages. E. Weight gain, high red blood cell count, flushing. The answer is E. Weight gain, high red blood cell count, flushing. Leukemia is a cancer of white blood cells, limiting the ability of the body to fight infection. Patients with leukemia exhibit altered leukocyte counts, less than 500,000 per cubic millimeters, as well as ulcerations of the mouth and throat, pneumonia, septicemia, anemia, fatigue, lethargy, weakness, pallor, weight loss, headache, disorientation, and forms of bleeding, including bleeding gums, ecchymosis, petechiae, and retinal hemorrhaging. Patients with leukemia do not usually exhibit weight gain, usually loss, high red blood cell counts, usually anemic, and flushing, usually pallor. The oncology nurse cares for a patient newly diagnosed with breast cancer. What are common risk factors for this type of cancer? A. Immunosuppression, advancing age, genetic predisposition. B. Smoking, advanced age, genetic disposition. C. Stress, advancing age, chronic irritation. D. Pharmaceutical use, alcohol, radiation. E. Radiation, chronic irritation, smoking. The answer is A. Immunosuppression, advancing age, genetic predisposition. All of these may be factors in the diagnosis of cancer. The operative word in the question is risk. Common risk factors for breast cancer include previous immunosuppression, advancing age, and genetic predisposition. Common causative factors include smoking, alcohol abuse, radiation, chronic irritation, consumption of food additives, exposure to industrial chemicals such as asbestos, exposure to dangerous pharmaceuticals such as stilbestrol, previous viral infections such as Epstein-Barr, and stress, when combined with other causative factors. You are the nurse taking care of a patient newly diagnosed with ovarian cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in ovarian cancer patients? A. BCR, ABL. B. c-Kit. C. Prostate-specific antigen, PSA. D. Cancer antigen 125, CA125. E. Cancer antigen 199, CA199. The answer is D. Cancer antigen 125, CA125. CA125, also known as mucin 16, is a glycoprotein that is found to have elevated serum levels in patients with a variety of cancers, including ovarian cancer, and benign conditions, as compared to patients without such conditions. As a result, monitoring California 125 levels can be used as a method of tracking disease progression or response to treatment based upon what the initial CA125 level is at the time of diagnosis. On the other hand, the other choices are incorrect. Cancer antigen 199, CA199, is incorrect as this is a biomarker in pancreatic cancer, not ovarian cancer. Prostate-specific antigen, PSA, is incorrect as this is a biomarker in prostate cancer, and other prostate conditions, not ovarian cancer. c-Kit is incorrect as this is a biomarker in gastrointestinal stromal tumors, not ovarian cancer. BCR, ABL is incorrect as this is the translocation found in the Philadelphia chromosome implicated in chronic myelogenous leukemia, not ovarian cancer. You are the nurse taking care of a patient newly diagnosed with pancreatic cancer. Which of the following biomarkers is typically followed to assess the progress of disease, or response to treatment, in pancreatic cancer patients? A. Cancer antigen 125, CA125. B. CD20 antigen. C. Cancer antigen 199, CA199. D. BRAF. E. CD30. The answer is C. Cancer antigen 199, California 199. California 199 is often elevated in patients who have pancreatic cancer, or certain types of colon cancers, and can be used to assess response to treatment and/or disease progression. On the other hand, the other choices are incorrect. Cancer antigen 125, California 125, is incorrect as this is a tumor marker used to track ovarian cancer, not pancreatic cancer. CD20 antigen is a tumor marker for B-cell lymphomas and leukemias, not pancreatic cancer. CD30 antigen is a tumor marker for anaplastic large cell lymphoma, not pancreatic cancer. BRAF is a tumor marker for melanoma, not pancreatic cancer. Which of the following image modalities would be best suited to diagnose a suspected lung cancer? A. EKG. B. Chest X-ray. C. EEG. D. CT scan. The answer is D. CT scan. CT scan is the preferred imaging modality to view a tumor in the lung tissue. A chest X-ray might initially find a nodule or abnormal marking in the lungs, but it must be followed up with a CT scan to be diagnostic. EKG looks at the heart and EEG looks at the brain. You are the nurse taking care of a patient in an oncology clinic who was treated with chemotherapy and radiation therapy for anal cancer. The patient finished treatment 2 weeks ago. Which of the following treatment side effects would you expect to see? A. Fever. B. Pupil dilation. C. Eye redness. D. Headache. E. Rectal bleeding. The answer is E. Rectal bleeding. The patient is being treated with chemotherapy and radiation therapy for anal cancer, and is multiple weeks removed from treatment. Rectal bleeding is a very common side effect in patients who recently received radiation therapy to the anus, as numerous blood vessels are treated by the radiation therapy, and the body's immunologic response to radiation therapy also promotes vascular permeability. Rectal bleeding, unless profuse and uncontrolled, is often a self-limiting phenomenon in the setting of radiation, and while troublesome for the patient, does not pose much of an acute threat to the patient's stability. Or radiation therapy for anal cancer, fever is something that should be taken seriously in any cancer patient, especially one receiving chemotherapy. However, it should not necessarily be expected. It should always be assessed for. Headache is a common side effect in patients actively receiving chemotherapy, often either directly due to the chemotherapy drug itself, or to dehydration as a side effect of treatment, lack of appetite. This patient is multiple weeks removed from chemotherapy though, so headache would not be expected as a treatment side effect at this time. Pupil dilation and eye redness are not typical side effects of chemotherapy or radiation therapy for anal cancer. You are the nurse at an oncology practice taking care of an otherwise healthy 22-year-old male being treated with chemotherapy and radiation for Hodgkin's lymphoma. His chemotherapy regimen consists of doxorubicin, bleomycin, vinblastine, and acarbazine. He is not receiving any other medications. He reports feeling well aside from fatigue, and numbness and tingling of his hands and feet. Which of the following is the most likely cause of the hand and foot numbness and tingling? A. Diabetic neuropathy. B. Posterior spinal cord degeneration. C. Selective serotonin reuptake inhibitor discontinuation syndrome. D. Bleomycin-induced neuropathy. E. Vinblastine-induced neuropathy. The answer is E. Vinblastine-induced neuropathy. This is the most likely explanation for this patient's peripheral neuropathy, as the patient is described as being healthy aside from Hodgkin's lymphoma, and on no medications aside from his chemotherapy regimen. As a result, diabetic neuropathy and selective serotonin reuptake inhibitor discontinuation syndrome can each be ruled out as etiologies. Similarly, given that he is otherwise healthy and not complaining of any additional neurological symptoms, and given that he is young and actively receiving chemotherapy, it is unlikely that he is experiencing posterior spinal cord degeneration. Thus, in a young patient with lymphoma who is receiving chemotherapy and experiencing peripheral neuropathy, the most likely etiology is one of the chemotherapy medications that he is receiving. In this patient's case, he is receiving doxorubicin, bleomycin, vinblastine, and acarbazine. Of these medications, Vinblastine is the most strongly associated with peripheral neuropathy, as this is a fairly common side effect of vinblastine and other agents in the same class, vinca alkaloids. As such, vinblastine-induced neuropathy is the most likely etiology. You are a nurse at an oncology clinic taking care of a 65-year-old male with stage 1 non-small cell lung cancer, NSCLC, who is 1 year removed from a wedge resection and chemotherapy. Which of the following tests would be best to assess treatment response in this patient? A. CT, without PET. B. X-ray. C. Pulmonary function tests. D. PET, CT. E. MRI. The answer is D. PET, CT. PET, CT shows not only spatial information from the serial slices taken on CT imaging, which would include the size and location of any potential tumor, scarring, or nodal involvement, but also the FDG avidity or uptake of the contents of the image, which would help correlate the spatial findings with possible disease activity. Nodules observed on a CT scan can be nondescript, ranging from malignant, to indeterminate, to benign, which may still be infectious or inflammatory. The addition of PET to a CT allows the observer to see which nodules, nodes, or lesions are more likely to be indicative of disease burden, as tumors and infections will have greater FDG uptake since they are more metabolically active than surrounding tissues. MRI is not typically used to assess treatment in lung cancer, as CT coupled with PET is more commonly used. X-ray does not provide enough resolution to adequately assess response to cancer treatment. Pulmonary function tests, while a useful measure of lung functionality, do not give a specific picture of the lung cancer burden and as such are not the best treatment response assessment tool. You are the nurse in an oncology clinic taking care of a patient with a glioblastoma who has been receiving chemotherapy and radiation therapy. You want to assess response to treatment. Which of the following images would best assess treatment response? A. CT head without contrast. B. PET, CT. C. MRI head. D. X-ray head. E. CT head with contrast. The answer is C. MRI head. In evaluating brain parenchyma, which is relatively soft tissue, MRI provides the greatest degree of spatial resolution, which would best allow assessment of any residual, recurrent, or new tumor burden within the brain. CT imaging is commonly used to assess the brain when evaluating for bleeds or fractures, among other conditions, as it is far more expedient than MRI. However, it does not visualize the soft tissue of the brain parenchyma as well as MRI, and treatment response MRI scans are often not emergent, and therefore MRI would be preferred. PET, CT, while often highly useful in oncologic assessments, is of limited value in evaluating the brain for cancer response, because the entire brain is highly metabolically active in nearly all patients, and therefore the entire brain typically has a great deal of FDG uptake uniformly, limiting the value of the scan. A client had just undergone a total right knee replacement and has just returned from the operating room. Later that evening, the client suddenly begins to complain of shortness or breath and chest pain on inspiration. The nurse caring for this client further notes the coughing up of blood and that he is sweating profusely. Which of the following nursing interventions should the nurse perform first? A. Assess the client's mental status. B. Place in Fowler's position. C. Auscultate for breath sounds. D. Give oxygen. E. Draw blood for arterial blood gases, ABGs. The answer is B. Place in Fowler's position. The priority for this client is to ensure a patent airway by placing him the Fowler's or semi-upright seated position. Giving oxygen is warranted but will be given after the client is positioned correctly. ABGs would be helpful in this situation but is not the priority. Auscultation of breath sounds and assessment of mental status are not indicated. What is the final stage of a pertussis infection? A. The recovery phase. B. The convalescent stage. C. The post-infectious stage. D. The paroxysmal stage. The answer is B. The convalescent stage. The final stage of a pertussis infection is known as the convalescent phase. This occurs for 2 to 6 weeks, after the paroxysmal stage of the disease. During this time coughing decreases, and paroxysms are less severe. The infected individual may experience increased susceptibility to upper and lower respiratory conditions for as much as 6 months after resolution of the infection. Which of the following organisms causes whooping cough? A. Haemophilus influenzae. B. Bordetella pertussis. C. Human respiratory syncytial virus, RSV. D. Klebsiella pneumoniae. The answer is B. Bordetella pertussis. Whooping cough, a condition that results in severe paroxysmal coughing fits followed by a long wheezing inspiratory gasp, the whoop, is caused by the bacteria Bordetella pertussis. Haemophilus influenzae and Klebsiella pneumoniae both commonly cause pneumonia, and RSV is a virus that is frequently implicated in lower respiratory infections of infants and children. In pertussis, what stage follows the incubation, also known as the catarrhal stage? A. The whooping stage. B. The paroxysmal stage. C. The acute stage. D. The convalescent stage. The answer is B. The paroxysmal stage. After the catarrhal stage, an individual with pertussis will progress into the paroxysmal stage. It's during this stage that they will experience uncontrollable fits of 5-15 forceful coughs, followed by a whoop or gasp as they struggle to inhale. The force of these coughs can be such that they can result in vomiting, epistaxis, subconjunctival hemorrhage, or even broken ribs. How long is the incubation period for pertussis? A. 4 to 6 weeks. B. 1 to 3 weeks. C. 2 to 3 months. D. 2 to 7 days. The answer is B. 1 to 3 weeks. The incubation period for pertussis, also known as the catarrhal stage, can last as little as 4 days or as long as 42 days, but a typical period is 1 to 3 weeks. During this stage the disease looks like a regular upper respiratory infection, with sneezing, mild cough, and runny nose. The infected individual is highly infectious at this time, with bacteria spread by airborne droplets after sneezing or cough. You are the nurse taking care of a 40-year-old African American female who complains of fatigue and shortness of breath. Her physical exam is remarkable for erythema nodosum on the bilateral lower extremities. A chest X-ray is performed that demonstrates bilateral hilar infiltrates. She lives and works in a suburb, has not traveled outside of the United States recently, and does not work in a healthcare setting. Which of the following is the most likely diagnosis? A. Meningitis. B. Sarcoidosis. C. Lung cancer. D. Pharyngitis. E. Tuberculosis. The answer is B. Sarcoidosis. This inflammatory condition is frequently found in African American women in their 40s who present with fatigue and shortness of breath among other symptoms, who also have erythema nodosum on the lower extremities, and have bilateral hilar infiltrates on chest X-ray. This constellation of findings is highly suggestive of sarcoidosis. Sarcoidosis results in the formation of numerous non-necrotizing granulomas, most commonly found in the lungs, that can play a role in the symptoms experienced by these patients. Other findings suggestive of sarcoidosis include elevated serum calcium levels with normal serum PTH levels. Tuberculosis can present in a similar manner to sarcoidosis, however, given the patient's suburban living environment, lack of a travel history, and lack of healthcare exposure, the likelihood of being exposed to tuberculosis is very low, making sarcoidosis a more likely etiology. While lung cancer can present a shortness of breath with hilar infiltration in chest X-ray, in a relatively young otherwise healthy patient who also has erythema nodosum and in whom the hilar infiltrates are bilateral, sarcoidosis would be a more likely etiology. The patient does not have any findings consistent with meningitis. Legratian meningitis is petechial, not erythema nodosum, or pharyngitis. What is the hygiene hypothesis in asthma? A. Keeping children's hands clean will reduce asthma rates. B. Dirty water is responsible for many cases of asthma in the developing world. C. Frequent bathing can reduce the severity of asthma attacks. D. Exposing children to pathogens at a young age will decrease their risk for asthma. The answer is D. Exposing children to pathogens at a young age will decrease their risk for asthma. Incidence of asthma is lower in populations exposed to an abundance of microbes from a young age. The hygiene hypothesis suggests that early immune stimulation by multiple forms of infectious agents may push a Th1 phenotype, reducing the Th2, allergic, response. All of the following are common triggers for asthma except dash. A. Exercise. B. Squatting. C. Cold air. D. Emotional stress or excitement. The answer is B. Squatting. The most commonly reported triggers for asthma attacks are cold air, emotional stress or excitement, infection, irritants such as pollen or dust mites, and exercise. Other triggers may include lying down, exposure to cigarette smoke, or acid reflux. A patient has been administered isoniazid for the treatment of tuberculosis, TB. Which statement made by the nurse would be the most appropriate when teaching the client about this medication? A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. B. This medication is associated with color blindness. C. This medication is expensive and may only be taken subcutaneously. D. This medication must be taken twice daily for 9 to 12 months. E. This medication must be given by DOT, directly observed therapy. The answer is A. This medication is known to cause peripheral neuropathy and therefore it is necessary to give pyridoxine prophylactically. Isoniazid is a bactericidal drug that is given for tuberculosis that has several adverse effects including peripheral neuropathy. This drug is usually administered in conjunction to other antitubercular drugs. Pyridoxine, vitamin B6, is recommended to be taken in conjunction with isoniazid to prevent neurotoxicity. Isoniazid is relatively inexpensive and may be taken orally or intravenously. It is not necessary to be taken under direct observation, and is usually dosed according to type of disease, active versus latent. The typical duration of administration is roughly 26 weeks. Color blindness is not associated with isoniazid treatment. All of the following changes may be seen in chronic asthma except A. Hypertrophy and hyperplasia of mucous glands. B. Destruction of alveolar septa and pulmonary capillaries. C. Epithelial desquamation. D. Deposition of subepithelial collagen. The answer is B. Destruction of alveolar septa and pulmonary capillaries. Chronic asthma can result in a situation referred to as airway remodeling, typified by the following changes: increased airway vascularity, epithelial desquamation, deposition of subepithelial collagen, and hypertrophy and hyperplasia of mucous glands and of the underlying muscle layer. Destruction of alveolar septa and pulmonary capillaries is a common finding in emphysema and does not present in asthma. At what stage are antibiotics effective in treatment of pertussis? A. Up to 6 weeks. B. Up to 2 weeks. C. Up to 8 weeks. D. Up to 4 weeks. The answer is D. Up to 4 weeks. Antibiotics have been shown to have very little effectiveness in treating a pertussis infection older than 4 weeks. Because of this, treatment with antibiotics to individuals that have been symptomatic for longer than 4 weeks is not generally recommended. A client is admitted to the ICU with acute respiratory distress syndrome, ARDS. The client has a recent history of bacterial pneumonia that has worsened and is at risk for hypoxemia. All of the following interventions apply to treatment for acute respiratory distress syndrome, ARDS, except A. An arterial catheter may be inserted to allow for blood pressure monitoring and ABG, arterial blood gas, blood sampling. B. Client may be placed in the prone position to increase the partial pressure of oxygen. C. Parenteral or enteral feeding will be necessary to meet high energy demands. D. The client should be given the highest concentration of oxygen that will yield a partial pressure of oxygen of 60 mm of mercury or greater. E. Daily weight should be taken to monitor fluid status. The answer is D. The client should be given the highest concentration of oxygen that will yield a PaO2 of 60 mm of mercury or greater. The oxygen concentration should be the lowest possible, due to the risk of oxytoxicity seen in clients with FiO2, fraction of inspired oxygen, levels exceeding 60% for more than 48 hours. A young male presents to the emergency department after a motor vehicle accident. Upon examination, it is found that the client will require a chest tube to reinflate his collapsed lung. All of the following correctly describe how a chest tube is placed except which of these? A. After placement, the tube is sutured to the chest wall and a dressing applied. B. During insertion, the tubes are to be clamped. Once in the pleural space, they are connected and unclamped at that time. C. A common location utilized for insertion is the fifth intercostal, mid-axillary line. D. If performed at bedside, sterile technique must be utilized. E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The answer is E. If air is to be removed, the chest tube is placed inferiorly and posteriorly. The correct placement of tubing includes directing a tube apically to remove air from the pleural space, and to direct the tube that will drain fluids in an inferior and posterior orientation. A 45-year-old male with COPD presents to the hospital with an exacerbation of his lung condition. He is in respiratory distress and the physician recommends he sit leaning forward. What is the purpose of sitting like this? A. To prevent falling. B. To help inhale air. C. To prevent loss of consciousness. D. To easily cough out secretions. E. To help exhale air. The answer is E. To help exhale air. COPD is a chronic lung condition marked by air trapping. Patients with COPD are instructed to sit in the tripod position to help them exhale air. Patients sit and lean forward to help maximize air exiting from the lungs. Which of the following best describes the mechanism of albuterol inhalers during an asthma exacerbation? A. Alpha-adrenergic antagonist. B. Beta-adrenergic antagonist. C. Beta-adrenergic agonist. D. Alpha-adrenergic agonist. E. None of these. The answer is C. Beta-adrenergic agonist. Albuterol is a beta-adrenergic agonist. It helps to open up the airways during an asthma exacerbation by activating the beta-adrenergic receptors, part of the sympathetic nervous system. Side effects include increased heart rate. What is the inspiratory reserve volume? A. The amount of air that can be exhaled after normal inhalation. B. The amount of air that can be inhaled after normal inhalation. C. The amount of air available in the lungs after exhalation. D. The normal amount of air that is inhaled with each breath. E. The total amount of air the lung can contain. The answer is B. The amount of air that can be inhaled after normal inhalation. The inspiratory reserve volume for the average adult is roughly 3,100 milliliters. It is tested using pulmonary function tests. The inspiratory reserve volume is the amount of air able to be inhaled after a regular inhalation. This is in contrast to the expiratory reserve volume, which is the amount of air that can be exhaled after a regular exhalation. Which of the following side effects would you most likely expect when providing an asthmatic patient with continuous nebulizer therapy? A. Bradycardia. B. Hypothermia. C. Tachycardia. D. Pinpoint pupils. E. Hypothermia. The answer is C. Tachycardia. Asthma is treated with albuterol. This drug is a beta-2 agonist, which works to relax smooth muscle in the lungs, and open up the airways. A consequence of this drug is the beta-2 effects on the heart. Beta-2 on the heart causes an increase in heart rate, tachycardia, and is a common side effect seen in the treatment of asthmatics. You are a pulmonology nurse taking care of a patient who complains of episodic wheezing. You perform a diagnostic test in which you perform pulmonary function tests on the patient before, and after administering albuterol, a beta-2 adrenergic agonist. You note that the patient's symptoms and FEV1 readings improve drastically with bronchodilator administration. Based upon these findings, the patient most likely has which of the following? A. Lung cancer. B. Chronic obstructive pulmonary disease. C. Sarcoidosis. D. Asthma. E. Throat cancer. The answer is D. Asthma. Asthma is an inflammatory airway condition that is characteristically improved symptomatically and quantitatively, in terms of pulmonary function tests, including FEV1 readings, with bronchodilator administration, for example albuterol, the beta-2 adrenergic agonist administered in this patient. In this patient who presented for evaluation of wheezing, a characteristic symptom of asthma, his substantial response to bronchodilator administration makes the likelihood of an asthma diagnosis very high. Chronic obstructive pulmonary disease, COPD, is an obstructive physiology of the airways often due to chronic tobacco smoking. While bronchodilators may be of some clinical value in these patients, their FEV1 readings characteristically do not correct after bronchodilator administration, as this is a major method in which COPD can be distinguished from asthma and other inflammatory airway conditions. Sarcoidosis, lung cancer, and throat cancer symptoms would not necessarily improve with bronchodilator administration, nor would pulmonary function test readings in patients with these conditions. A 45-year-old obese male with a history of obstructive sleep apnea, hypertension, diabetes, and coronary artery disease presents to your primary care clinic for help in managing his fatigue due to his sleep apnea. He is not a candidate for tonsillectomy and adenoidectomy. Which of the following interventions would be the best recommendation to treat his obstructive sleep apnea? A. Continuous positive airway pressure mask, CPAP. B. Metoprolol. C. Insulin. D. Metformin. E. Tamsulosin. The answer is A. Continuous positive airway pressure mask, CPAP. CPAP mask helps to force airway into the lungs that is otherwise obstructed by the patient's oropharyngeal anatomy as standard breathing pressures due to obstructive sleep apnea. When wearing a CPAP mask, typically when sleeping, snoring is reduced, and oxygenation is improved, allowing patients to have a more restful sleep and feel less fatigued the following day, while medications like metoprolol, insulin, and metformin may be beneficial to the patient in treating his conditions comorbid to obstructive sleep apnea, they do not have a direct effect on treating his sleep apnea or the resultant fatigue. Tamsulosin is an alpha-adrenergic blocker and can be used to treat benign prostatic hyperplasia among other conditions, but not obstructive sleep apnea. Which of the following best describes a diagnosis of uncomplicated or simple silicosis? A. Silica in the bloodstream but no clinical symptoms. B. Mild ventilation restriction and fibrosis on chest X-ray. C. Normal pulmonary function but shortness of breath. D. Massive pulmonary fibrosis visible on chest X-ray, but no extrapulmonary symptoms. The answer is B. Mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis results in mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis often results from long-term exposure to relatively low concentrations of silica dust, where symptoms usually appear 10 to 30 years after exposure. A 63-year-old female client is newly admitted to the hospital for pneumococcal pneumonia. The nurse recognizes that this patient will most likely exhibit certain symptoms associated with this condition. Which clinical findings are most commonly consistent with pneumococcal pneumonia? A. Headache, muscle aches, and a cough with frothy pink sputum. B. Slow onset of cough, nasal congestion, sore throat, and fever. C. Fever, chills, and a non-productive cough. D. Sudden onset of fever, chills, with a productive cough with rust-colored sputum. E. Dry cough with fatigue, nausea and vomiting. The answer is D. Sudden onset of fever, chills, with a productive cough with rust-colored sputum. Pneumococcal, bacterial, pneumonia typically presents with an abrupt onset of fever, shaking chills, and a productive cough, usually rust in color. Usually viral pneumonias will present with a dry non-productive cough and associated with other viral infections. What population is most at risk during pertussis infection? A. Infants. B. Adolescents. C. Pregnant women. D. Elderly. The answer is A. Infants. Due to their susceptibility to suffocation, infants are more at risk of mortality than older children, pregnant women, or the elderly during pertussis infection. Mortality in infants with this condition can be as high as 2%. There is also an increase in infant comorbidities such as pneumonia, encephalopathy, seizures, and failure to thrive. You are the nurse taking care of a 78-year-old man with a 60-pack year smoking history who is hospitalized for shortness of breath. You review the X-ray and notice a 1 cm solitary pulmonary nodule within the middle lobe of the right lung. Which of the following is the most appropriate next step? A. Attempt to obtain and review a prior X-ray. B. Refer the patient for surgical excision of the nodule. C. Arrange for a biopsy of the nodule. D. Administer radiotherapy to the pulmonary nodule. E. Administer chemotherapy. The answer is A. Attempt to obtain and review a prior X-ray. While the patient appears to have a very concerning story for a primary lung neoplasm given his age and smoking history, or a metastasis from another neoplasm, if this nodule was noted on a prior X-ray, especially a much older X-ray, and is unchanged, then the degree of concern about the nodule is much lower, given its stability over time. On the contrary, if you can obtain a recent prior X-ray and the nodule is not present on that scan, or has grown since that scan, then the level of concern about the nodule should be greater, and should guide clinical decision-making as such. Measures such as biopsy, surgery, chemotherapy, or radiotherapy administration are all possible future steps if indeed this pulmonary nodule turns out to be a malignant neoplasm. That being said, there is no definite evidence at this time that the patient's nodule is of malignant origin. And should this nodule be something that has been stable on prior X-rays for multiple of years, then the level of concern should be far lower, and the need for more invasive measures would be obviated. Which of the following terms describes the congenital abnormality of the forebrain in which an infant is born with a diminished brain size? A. Agyri. B. Microcephaly. C. Polymicrogyri. D. Anencephaly. The answer is B. Microcephaly. Microcephaly denotes a congenital abnormality of the forebrain in which an infant is born with a diminished brain size. Potential causes include fetal alcohol syndrome, congenital rubella, and trisomy 18. The other answers are all examples of congenital forebrain birth defects. Anencephaly is the complete absence of major portions of the brain, skull, and scalp. Agyri is the absence of gyri. Polymicrogyri is a condition in which gyri are too many, too small, and very shallow. Anencephaly and other neural tube defects have been linked to maternal deficiency of what nutrient? A. Calcium. B. Biotin. C. Folate. D. Beta-carotene. The answer is C. Folate. Anencephaly and other neural tube defects have been linked to maternal deficiency of folate. This is most likely due to folate's role in methylation and nucleic acid synthesis. The other nutrients listed are all important to maternal health but have no known correlation with neural tube defects such as anencephaly. Paraventricular leukomalacia, PVL, is the most common finding on autopsy of newborns with what condition? A. Fetal alcohol syndrome. B. Cerebral palsy. C. Anencephaly. D. Hypoxia. The answer is B. Cerebral palsy. Paraventricular leukomalacia is the most common finding on autopsy of newborns with cerebral palsy. PVL involves the softening of the brain tissue and subsequent death of the white matter. This is caused by lack of blood flow to the paraventricular area of the brain, which results in necrosis and gliosis of brain tissue. Neonates born with PVL are likely to have mental impairment, motor disorders, and compromised vision and hearing. PVL is usually diagnosed with ultrasound of the head. None of the other conditions listed typically present with this finding. A mother 1 hour post-birth expresses concern because her baby's head looks slightly cone-shaped. The nurse tells the mother that A. This is normal and usually temporary. B. This is normal but is not temporary. C. This is abnormal but does not require immediate medical intervention. D. This is abnormal and she should consult a neurologist. E. This is abnormal and she should contact her pediatrician. The answer is A. This is normal and usually temporary. It is normal for a child's head to be slightly misshapen immediately following birth. The infant's skull is composed of bony plates connected by membranes, fontanelles, allowing for accommodation of the baby's growing brain. Caput succedendum, swelling of the scalp, can also be found following a long delivery. A misshapen head usually resolves on its own and is normal but does not require any medical intervention. A baby is born with a heart rate of 99 beats per minute, irregular breathing, good flexion, frowns when you suction the nose, and with pink color throughout the body and limbs. What is the baby's Apgar score at 1 minute? A. 9. B. 8. C. 7. D. 10. E. 6. The answer is C. 7. An Apgar, appearance pulse grimace activity respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the Apgar scoring method, point allocations are as follows. Heart rate of less than 100, 1. Good flexion, 2. Frown, reflex, 1. Irregular respirations, 1. Pink skin color, 2. We add these to get the final Apgar score of 7. A baby is born with a heart rate of 60 beats per minute. The baby is not breathing, has limp limbs, is flaccid and pale. What is the baby's Apgar score at 1 minute? A. 1. B. 4. C. 2. D. 8. E. 0. The answer is A. 1. An Apgar, appearance pulse grimace activity respiration, score is a quick assessment designed to indicate the condition of the baby after birth. Referring to the Apgar scoring method, point allocations are as follows. Heart rate less than 100, 1. Poor flexion, 0. Absent reflex, 0. Apnea, 0. Pallor, 0. We add these individual scores to get the Apgar score of 1. A pair of new parents are concerned because their baby has lost 4% of its birth weight at 3 days of life. The nurse instructs the parents to dash. A. Consider switching brands of formula. B. Continue feedings as usual. C. Feed every 5 hours. D. Notify a pediatrician. E. Feed only breast milk until the infant's weight increases. The answer is B. Continue feedings as usual. It is common for infants to lose up to 10% of their weight in the first week of life. Greater than a 10% loss indicates a problem. For an infant within these parameters, there is no need to make a change in feedings. Infants in the first week of life should be fed every 2 to 3 hours if breastfeeding and every 3 to 4 hours if formula feeding. Julie is a new registered nurse who is assessing a child in his 3rd month of life. The assessment is part of a routine appointment at a public health clinic. She knows that the anterior fontanelle of most infants closes between A. 18 to 20 months of age. B. 3 to 6 months of age. C. 1 to 3 months of age. D. 6 to 9 months of age. E. 12 to 18 months of age. The answer is E. 12 to 18 months of age. The anterior fontanelle is commonly referred to as the soft spot located atop a child's head. It allows considerable brain growth until it closes, generally between 12 to 18 months. However, the fontanelle may close on some children as early as 9 months. Which of the following is considered a late sign of hunger in the newborn? A. Crying. B. Sucking motions. C. Bringing hands to chin. D. Rooting. E. Chewing on the fists. The answer is A. Crying. Crying is considered a late sign of hunger. By the time the infant cries, they may be more difficult to console or to feed, especially if breastfeeding. Feed on cue when the infant is rooting, making sucking motions, or when they are frequently bringing their hands to their face or mouth. Which of the following should the nurse do if he or she finds a baby with irregular breathing? A. Check oxygenation through a portable pulse oximeter. B. Note the finding on the patient's chart. C. Check for oral obstruction of the infant's airway. D. Deliver oxygen through a simple mask. The answer is B. Note the finding on the patient's chart. It is normal for infants to breathe irregularly. Often, brief periods of apnea are present. Infants should breathe between 30 and 60 times per minute. For this purpose, noting the finding as a vital sign in the patient's chart is the correct action. No further intervention is necessary in response to a normal assessment. Carrie is a first-time mother caring for her new baby boy. She notices that as she touches his cheek, he turns towards that side and opens his mouth. The nurse tells Gary that this is a reflex called A. Plantar grasp. B. The rooting reflex. C. Palmar grasp. D. The Moore reflex. E. The Babinski reflex. The answer is B. The rooting reflex. The question describes the rooting reflex. The Moore reflex is shown when an infant is startled and or feels loss of support as if he or she is falling. He or she will extend the arms above the body in a curved shape. The Babinski reflex occurs in response to stimulation of the sole of the foot. Typically, the large toe will extend or remain extended as the others move. Infants may also exhibit plantar grasp with application of pressure to the foot. In plantar grasp, the toes will flex inward. Infants displaying palmar grasp will close their fingers around an object placed in their hand. Which of the following findings are abnormal upon assessment of an infant on the third day of life? A. Mottled skin. B. Firm stools. C. Blue tint to the hands and feet. D. Fine hair covering large body surfaces. E. Small, white spots present on the bridge of the nose. The answer is B. Firm stools. Hard or firm stools are abnormal for an infant on their third day of life. Typically, infants will have meconium, dark, sticky, stools for the first several days as a result of amniotic fluid ingestion. Over the next couple days they will transition to a seedy yellow, breastfed infants, or peanut butter consistency, formula-fed infants. Acrocynosis, blue color on the extremities, is normal in infants. Mottling is also common. Infants have a developing cardiovascular system and many capillaries that exist close to the surface of the skin. Milia are normal white spots that frequent the faces of newborns. It is important not to pick or scratch these white spots to prevent scarring. Infants are also frequently born with fine hair called lanigo covering the body's surfaces. Some babies may be born with more lanigo than others. While assessing a 4-month-old infant, the nurse notices hyperpigmented nevi on the lower back. Which of the following is false regarding hyperpigmented nevi? A. Hyperpigmented nevi fade over time. B. Hyperpigmented nevi are most commonly found on dark-skinned children. C. Hyperpigmented nevi are frequently mistaken as bruises. D. Hyperpigmented nevi may be scattered. E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. The answer is E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. Hyperpigmented nevi have been previously called Mongolian spots. They occur most commonly in dark-skinned children and fade as the child ages. They are often mistaken for bruises. Sturge-Weber syndrome is a neurological disorder which is present at birth and associated with port wine stain birthmarks. While using an otoscope, how does the practitioner correctly examine the tympanic membrane of a toddler? A. Pull back on the upper pinna. B. Pull forward on the upper pinna. C. Pull down on the earlobe. D. Pull upwards on the earlobe. E. Pull up on the upper pinna. The answer is C. Pull down on the earlobe. Examine the eardrum of infants and toddlers by pulling down on the earlobe. Examine the eardrum of an older child by pulling up on the outer pinna. Additional help from colleagues or caregivers may be necessary when examining small or upset children. Rubeola is caused by which of the following viruses? A. Varicella zoster. B. Measles. C. Human herpes virus. D. Coxsackie virus A16. E. Parvovirus B19. The answer is B. Measles. Rubeola is caused by the measles virus and is extremely contagious. Airborne precautions must be used when measles are suspected. Patients who are affected by measles may exhibit a high fever, cough, conjunctivitis and a rash among many other symptoms. Contraction of measles may be prevented by administration of MMR, measles, mumps, and rubella, through vaccination. Human herpes virus include a family of related viruses of which varicella, zoster virus, causes chickenpox and shingles, is a member. Parvovirus B19 may cause fifth disease, among other conditions. Coxsackie virus A16 causes hand-foot-mouth disease. Which of the following would be considered appropriate in the treatment of a child with Lyme disease? A. Restricted fluid intake. B. A clear liquid diet. C. Contact precautions. D. Promotion of bed rest. E. Administration of antibiotics. The answer is E. Administration of antibiotics. Lyme disease is caused by the bacteria Borrelia burgdorferi. It is a vector-borne disease that is contracted secondary to the bite of an infected tick. Administration of antibiotics is crucial to recovery. Standard precautions are adequate. Restricting fluids, diet, or activity is not necessary. A mother calls the clinic because her son is 5 years of age and has been experiencing incontinence of diarrhea for 3 days. He has a past medical history of constipation. The physician has diagnosed the child with encephalitis. The nurse may recommend the family try which of the following? A. Restricting activity until the diarrhea goes away. B. Encouraging a low-fiber diet. C. Limiting sugary food consumption. D. Giving the child an enema. E. Taking calcium carbonate tablets. The answer is D. Giving the child an enema. Constipation is a common complaint in children. Encephalitis occurs when children are incontinent of fecal matter after toilet training. Often, a child will leak stool surrounding a large fecal mass that has hardened in the rectum. Giving a child an enema may help to clear the mass and restore bowel function. Constipation should be avoided through exercise, high-fiber diet, and adequate liquid ingestion. A school nurse examines a 5-year-old child who comes into the office with belly pain. The nurse palpates McBurney's point and the child winces and pulls her knees to her chest. The school nurse phones the parents to tell them which of the following? A. The child should be taken to the hospital immediately. B. The child may be experiencing reflux, spicy foods should be avoided. C. The child should be picked up and brought home. D. The child is likely constipated and will need to be seen in the office tomorrow. E. If the pain persists, make an appointment to see the physician later in the day. The answer is A. The child should be taken to the hospital immediately. Tenderness over McBurney's point, 1/3 the distance from the anterior superior iliac spine to the navel, may indicate appendicitis. This should be treated as a surgical emergency and the child should be taken to the emergency room. Other symptoms of appendicitis include nausea, vomiting, fever, and frequent soft stools. Rubella is a viral illness that commonly affects children. Which of the following is another name for rubella? A. Chickenpox. B. Measles. C. Fifth disease. D. Hand, foot, and mouth disease. E. German measles. The answer is E. German measles. All of the above are viral illnesses commonly found in children. Rubella may be referred to as German measles and is spread through droplets. The disease is generally mild, presenting with a rash that typically lasts around 3 days. Maternal rubella may spread to the fetus and cause severe complications. Rubeola, also known as measles, is highly contagious and is caused by the measles virus. Chickenpox is caused by the herpes zoster, varicella, virus. Hand-foot-mouth disease is a viral disease caused by Coxsackie virus A16. Fifth disease is caused by parvovirus B19 and presents with bright red rashes on the cheeks and other parts of the body. The nurse is caring for a 1-year-old male client who has been brought to the emergency room because his parents state that he has been more fussy than usual. He has current jelly stools and is vomiting. What may the nurse suspect? A. Intussusception. B. Umbilical hernia. C. Pyloric stenosis. D. Inguinal hernia. E. Encephalitis. The answer is A. Intussusception. Intussusception occurs when a portion of the bowel is pushed into another portion. It most commonly affects children under the age of 2. Red currant jelly stools, stool mixed with blood and mucus, vomiting, and pain are common symptoms. Red currant jelly stools are a hallmark of intussusception. Pyloric stenosis generally causes reflux post-feeding, and encephalitis affects children who have already been toilet trained. Hernias are rare in young patients. Encephalitis refers to involuntary fecal soiling in children who are already toilet trained, and does not involve abnormal stool, such as currant jelly characterization. Which of the following is a typical clinical sign of aortic insufficiency in a pediatric patient? A. Exercise intolerance. B. Excessive sweating. C. Frequent epigastric pain. D. Mania. The answer is A. Exercise intolerance. Exercise intolerance is a typical clinical finding in pediatric patients with aortic stenosis. This condition may present with any of the other symptoms, but mania, excessive sweating, and epigastric pain are not directly associated with aortic insufficiency in this population. Parvovirus B19 causes which of the following conditions? A. Roseola infantum. B. Fifth's disease. C. Rubeola. D. Scarlet fever. The answer is B. Fifth's disease. Parvovirus B19 causes Fifth's disease, sometimes referred to as slap cheek syndrome, due to the bright red cheeks that often present with the infection. Scarlet fever is caused by group A Streptococcus infection. Roseola infantum is caused by either human herpes virus 6 or human herpes virus 7. Rubeola, or measles, is caused by the measles virus. What is the incubation period for varicella, chickenpox? A. 48 to 72 hours. B. 14 to 28 days. C. 2 to 7 days. D. 10 to 21 days. The answer is D. 10 to 21 days. Varicella, caused by an infection with the varicella zoster virus, has an incubation period of 10 to 21 days. Which of the following infections is the most common cause of hand, foot, and mouth disease? A. Enterovirus 71. B. Human herpes virus 6. C. Parvovirus B19. D. Coxsackie virus A16. The answer is D. Coxsackie virus A16. The most common cause of hand, foot, and mouth disease in the United States is Coxsackie virus A16. Enterovirus 71 can also cause hand, foot, and mouth disease, though it is a less common etiology. Parvovirus B19 causes fifth disease, sometimes referred to as slap cheek syndrome. Human herpes virus 6 is one of two viruses that cause roseola infantum. While doing a standard ophthalmoscopic exam on a 7-year-old female, the examiner notices that while the light reflex of the left eye is red, the light reflex of the right eye appears bright yellow. The right pupil is also less reactive to light, and the right eye appears to be slightly bulging. The examiner should be suspicious of which of the following conditions? A. Cataract. B. Hordeolum. C. Pincula. D. Retinoblastoma. The answer is D. Retinoblastoma. Retinoblastoma is the most common form of ocular cancer in children. It is derived from developing retinal cells. The most common symptoms are a white or yellow light reflex, also known as leukochoria, diminished pupillary reflex, crossing of the eyes, impaired vision, and bulging of the affected eye. A cataract may also cause the pupil to appear white or to produce a white or yellow light reflex, but it will not cause bulging of the eye. A pincula is a fatty deposit on the sclera which will not alter the red light reflex, and a hordeolum is outside the eye itself. It is an infection of a hair follicle of the eyelid, also known as a stye. A labor and delivery nurse is speaking to a new mother about her premature infant, and is explaining why the infant will have difficulty with heat regulation. Which of the following statements made by the nurse best explains why a preterm infant cannot conserve heat properly? A. The preterm infant has an immature hypothalamus, which cannot set the infant's internal temperature properly, leading to large amounts of heat being lost via convection. B. The preterm infant has too little protein reserves around the kidneys, the neck, between the scapulae, and behind the sternum, and therefore cannot generate heat and can lead to hypothermia. C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as a lack of brown fat that provides heat to infants due to its unique thermogenic properties. D. The preterm infant lacks white fat, which provides the infant with a heat source due to underdeveloped and the inability to utilize the process of shivering to produce heat. E. The preterm infant cannot generate heat effectively because of a lack of surfactant in the skin and therefore cannot generate or preserve a proper body temperature. The answer is C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. A preterm infant cannot conserve heat due to several reasons. The infant has a lack of subcutaneous fat, has a large surface area relative to their body weight, a lack of glucose reserves, and a lack of brown fat, which is a unique type of fat that is capable of generating a greater amount of heat than just ordinary fat. What specific enzyme deficiency accounts for 95% of all cases of congenital adrenal hyperplasia? A. 7-alpha hydroxylase deficiency. B. 21-hydroxylase deficiency. C. Beta-glucuronidase deficiency. D. Estrogen synthetase deficiency. The answer is B. 21-hydroxylase deficiency. In 21-hydroxylase deficiency, cortisol production is reduced, which in turn causes adrenocorticotropic hormone, ACTH, to increase. The precursors for the cortisol are then shunted into androgen production since these are steroids, and are thus derived from cholesterol. The community health nurse knows that teaching has been effective when the father of a newborn states A. I will place my child on her back to sleep. B. I will place my child on her back and in a crib with stuffed animals to create familiarity. C. I will place bumper pads in the crib to prevent injury. D. My child will sleep in the bed with me until the first month of life. E. I will place my child on her side to sleep, supported by pillows. The answer is A. I will place my child on her back to sleep. Newborns should be placed on their back, in their crib, with nothing else when put to sleep. The crib may contain a fitted sheet or light blanket. Crib pads, pillows, and stuffed animals are not advised because they may interfere with the child's ability to breathe. The postpartum nurse is caring for a family and their new baby, a 2-day-old infant. The baby is spitting up following every formula feeding. The nurse may suggest A. Giving only 15 to 30 milliliters per feeding. B. Laying the baby on its back after feedings. C. Switching brands of formula. D. Increasing the frequency of feedings. E. Using a soft instead of a standard bottle nipple. The answer is A. Giving only 15 to 30 milliliters per feeding. Typically, the digestive system of a 2-day-old infant can only accommodate 15 to 30 milliliters of formula comfortably. The infant's stomach will grow considerably over the coming weeks. Frequent spitting up could be due to overfeeding. Before switching formula brands, try decreasing the amount fed at each feeding. Increasing the frequency of feedings may add to this problem. Another possibility, that the infant is feeding too fast, may be corrected by using a slow flow instead of a soft or standard nipple. Soft nipples may be helpful in infants with poor suck or latch. While feeding and directly afterwards, it is advised to keep the infant in a semi-upright position. Therapy has the ability to positively impact children who are cognitively, socially, emotionally, or physically challenged. Which of the following therapies is most closely related to therapy? A. Art therapy. B. Massage therapy. C. Pet therapy. D. Music therapy. E. Herbal therapy. The answer is C. Pet therapy. Therapy is therapeutic horseback riding for the handicapped. The motion of the horse can help the child develop flexibility and balance. Working with others and animals can help the child cross social and emotional boundaries. A therapy involving animals, pet therapy, is most similar to therapy. Jennifer is a 14-year-old patient who has been diagnosed with diphtheria and subsequently, myocarditis. The nurse implements all of the following except A. Practicing standard precautions. B. Enforcing bed rest. C. Administering antitoxin. D. Administering antibiotics. E. Practicing airborne precautions. The answer is E. Practicing airborne precautions. Diphtheria is an illness caused by bacteria, Green Bacterium diphtheriae. It is spread through droplets, requiring droplet precautions. Standard precautions should also be used, as with any patient. Delivery of antitoxin and antibiotics are important to a patient's recovery. Enforcing bed rest is important after a patient has developed myocarditis, inflammation of the heart. A community health nurse is giving a presentation on pertussis, whooping cough. He tells his audience that which population is most at risk. A. Older adults above 85. B. Older adults from 65 to 75. C. Older adults from 75 to 85. D. Children under 4 years of age. E. Children from 4 to 12. The answer is D. Children under 4 years of age. Children under 4 years of age hold the greatest risk of contracting pertussis and developing serious complications, including death. Pertussis vaccines are recommended for all age groups. Children can start a vaccination series as early as 2 months of age. New parents are encouraged to become vaccinated before their baby arrives to prevent transmission before the infant is eligible for immunization. A room designed to accommodate a child with the measles should include which of the following? A. Negative air pressure. B. Low microscopy pressure device. C. Positive air pressure. D. No air pressure device is necessary. E. High microscopy pressure device. The answer is A. Negative air pressure. Measles is an airborne illness. For that reason, air pressure devices are necessary to prevent the spread of infection. Negative air pressure devices will adequately contain the measles virus because air will flow into the room as opposed to out. Conversely, positive air pressure devices may be used to create an airflow out of a room in severely immunocompromised patients. The school nurse is approached by a 9-year-old boy who is complaining of severe scalp pruritus. Upon closer examination, the nurse concludes that he has a case of head lice, pediculosis capitis. She knows all of the following to be true except dash. A. Treating the clothing of the child may be necessary. B. His personal grooming items should be soaked in hot water or shampoo. C. Sealing his backpack in a plastic bag for 10 days should kill the lice. D. His 5-year-old sister should be examined. E. Head lice may be a sign of poor hygiene. The answer is A. Head lice may be a sign of poor hygiene. Children and adults with exceptional personal hygiene are equally affected by head lice. The same applies to people of all socioeconomic groups, genders, and nationalities. All of the other options are true nursing interventions for head lice. A school nurse is holding a question and answer meeting for parents following a recent outbreak of scarlet fever. Which of the following would the nurse confirm as false? A. Scarlet fever is transmitted through the air. B. Children over 2 years of age are higher risk than children under 2 years of age. C. Scarlet fever is a viral infection. D. A rash develops secondary to toxin sensitivity. E. A child may or may not develop a rash after exposure. The answer is C. Scarlet fever is a viral infection. Scarlet fever is a bacterial infection caused by group A streptococcus that is transmitted through the air. Children who are sensitive to the bacterial toxin may develop a rash, although some will not. Infants and toddlers under the age of 2 are rarely seen with the disease. A 3-day-old infant is diagnosed with hyperbilirubinemia. A bilirubin test is required by capillary heel puncture. The nurse does all of the following except dash. A. Using an antiseptic wipe to cleanse the foot. B. Squeezing the infant's heel while collecting the sample. C. Wiping away the first drop of blood. D. Turning off the bilirubin treatment lights before collecting the sample. E. Applying heel warmers to increase capillary blood flow. The answer is B. Squeezing the infant's heel while collecting the sample. Avoid squeezing the infant's heel if possible. Squeezing causes hemolysis of the specimen. Too much pressure may also result in damage to the tissue. Turning off the bilirubin treatment lights is also important because exposure to the light may alter the bilirubin in the sample. Cleansing the site of puncture is important, and warming the area will increase the capillary blood flow. A mother brings her child in for paroxysmal bouts of 10 to 15 coughs followed by 1 to 2 deep gasping breaths. It started as a simple cold and cough, which seemed to be getting better before the gasping paroxysmal coughing started. The coughing is severe enough that he has vomited several times. What is the most likely diagnosis? A. Pertussis. B. Croup. C. Bronchitis. D. Pneumonia. The answer is A. Pertussis. The most likely diagnosis in this case is pertussis, also known as whooping cough. This is caused by Bordetella pertussis, a gram-negative encapsulated coccobacillus. It begins as a seemingly normal upper respiratory infection, which progresses 2 weeks after onset into paroxysms of 5 to 15 violent coughs followed by a forceful inspiratory gasp, often described as a whoop. Coughing is often forceful enough to induce vomiting, nosebleeds, or subconjunctival hemorrhage. Croup, pneumonia, and bronchitis are all conditions that include cough, though none of them will generally present with this degree of gasping, vomiting, or blood vessel damage due to cough. Strawberry tongue and maculopapular, sandpaper, rash are commonly seen in what childhood exanthem? A. Scarlet fever. B. Varicella. C. Impetigo. D. Roseola. The answer is A. Scarlet fever. Strawberry tongue, glossitis, and maculopapular, sandpaper, rash are commonly seen in scarlet fever, a condition caused by group A Streptococcus bacteria, often after a bout of strep throat. The other exanthems listed can all cause erythematous rash, though none are associated with glossitis. Parotid gland enlargement, fever, myalgia, and tender salivary glands would indicate which of the following conditions? A. Rubella. B. Measles. C. Mumps. D. Herpes angina. The answer is C. Mumps. Parotid gland enlargement, fever, myalgia, and tender salivary glands are all indicative of infection with the mumps virus. Symptoms typically last for 7 to 10 days, though sequelae such as hearing damage and testicular disorders can be long-lasting or even permanent. A nurse working in labor and delivery is responsible to assessing a newborn according to the Apgar scale. The newborn infant is noted to have a vigorous good cry, a heart rate of 97, with good reflexes, and acrocyanosis. What is the newborn's Apgar scale according to these findings? A. 8. B. 9. C. 7. D. 6. E. 3. The answer is A. 8. The Apgar score is 8, the child has received a score of 2 under respiration for good cry, a score of 2 under cry reflex for vigorous crying, a score of 2 under reflexes for good reflexes, a score of 1 for heart rate of 97, under 100 bpm, and score of 1 for color for acrocyanosis, blue limbs, pink body. You are the nurse taking care of a 19-year-old patient at a primary care clinic who complains of fever, tonsillar exudates, tender anterior cervical lymph nodes, and a sore throat without a cough. How many of the center criteria for streptococcal pharyngitis does this patient exhibit? A. 4. B. 1. C. 3. D. 2. E. None of these. The answer is A. 4. The patient exhibits 4 out of the 4 center criteria for streptococcal pharyngitis. The center criteria are as follows: 1. Tonsillar exudates; 2. Lack of cough; 3. Fever; 4. Tender anterior cervical lymphadenopathy. The center criteria are used to generate a score based upon the patient's age and number of positive criteria. This score can then be used to assess the likelihood that the patient's condition is due to streptococcal pharyngitis, and therefore to guide the decision of whether or not to treat with antibiotics for streptococcal pharyngitis. In this patient's case, since they are older than 14 and younger than 45, they do not gain nor lose points for their age. They get 4 points total for having all of the positive criteria. Therefore, it is highly likely that they are infected with streptococcal pharyngitis and should be treated empirically with antibiotics. The pediatric nurse is counseling a mother-baby couplet who are having trouble breastfeeding. The baby is showing poor suck and falling asleep at the breast. Which of the following is not an appropriate intervention? A. Play with the feet of the newborn while feeding. B. Feed the infant according to infant's cues. C. Feed the baby every 3 hours until they become in sync with the pattern. D. Unswaddle and undress the baby prior to placing at breast. E. Gently caress or rub the head of the infant. The answer is C. Feed the baby every 3 hours until they become in sync with the pattern. When presented with an infant showing poor suck, it is important to feed when cues are given. The infant will suck best when hungry. However, a breastfed infant should not go more than 3 hours between routine feedings in order to establish healthy weight gain. Feeding every 3 hours regardless of cue is less advisable. Unswaddling, undressing, and stimulating the infant can sometimes aid in keeping them awake and sucking well at the breast. Individuals who contracted varicella zoster, chickenpox, in childhood may experience which of the following if the virus is reactivated later in life? A. Scarlet fever. B. Rheumatic fever. C. Orchitis. D. Shingles. The answer is D. Shingles. A common sequela of varicella is shingles, a painful rash caused by reactivation of the varicella zoster virus along the single dermatome that corresponds with the site of initial infection. Rheumatic fever and scarlet fever are both possible sequelae of streptococcus infection, and orchitis is a potential sequela or comorbidity of infection with the mumps virus. At what point is a child with varicella no longer contagious? A. By the time the lesions are visible, the child is no longer contagious. B. After the last lesion has broken open and crusted over. C. 7 days after the initial presentation. D. After the last lesion is no longer visible. The answer is D. After the last lesion has broken open and crusted over. Varicella is a highly contagious infectious disease of childhood. It is no longer contagious when the last lesion has broken open and crusted over. Until then, the virus can be spread via respiratory droplets, by contact with the saliva of an infected child, or by touching an unbroken blister or the fluid within a blister. What is the most common cause of renal failure in the United States? A. Renal cell carcinoma. B. Polycystic kidney disease. C. Drug overdose. D. Diabetes mellitus. The answer is D. Diabetes mellitus. The most common cause of renal failure in the U.S. is diabetic nephropathy due to diabetes mellitus. Diabetic nephropathy can include multiple complications including arterial sclerosis, glomerulosclerosis, pyelonephritis and renal failure. A nurse is caring for a client experiencing the oliguric phase of acute kidney failure. The nurse is aware that this condition is highly associated with electrolyte imbalances, in addition to the kidney's inability to produce sufficient amounts of urine. Which of the following electrolyte imbalances should the nurse monitor for? A. Hypernatremia and hypoglycemia only. B. Hyperlumbemia, hypercalcemia, and hypoglycemia. C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. D. Hypoglycemia, hyponatremia, and decreased creatinine levels. E. Hypercalcemia, hypophosphatemia, and decreased nitrogen wastes. The answer is C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. During the oliguric phase of acute kidney failure, AKF, the kidney is unable to excrete potassium properly, leading to high serum levels that could lead to dangerous CCG changes including peaked T waves and wide QRS complexes. The kidneys are also responsible for activating vitamin D, allowing for proper calcium absorption from the GI, which becomes decreased during AKF. Bicarbonate is also handled by the kidney and cannot be regenerated properly by the kidney during AKF. An electrical worker has been brought to the emergency department after an electrical burn injury sustained while in the field. The possibility of additional injuries are greatly increased when dealing with this type of clinical scenario. The nurse examining the client should be aware that A. All patients with electrical burns are at risk for cervical spine injuries and immobilization of the cervical spine should be a priority. B. The patient is at increased risk for metabolic alkalosis and should be receiving fluids continuously with the addition of sodium bicarbonate. C. Electrical burns are different from other burns in that the damage that occurs is readily visible. D. Massive losses of myoglobin from muscle damage can lead to liver dysfunction, thereby leading to liver failure. E. After an electrical burn occurs, the damage to the underlying tissues can continue for up to 72 hours. The answer is A. All patients with electrical burns are at risk for cervical spine injuries and immobilization of the cervical spine should be a priority. The risk for cervical spine injury is high due to electrical workers being subjected to having to work on utility poles that upon electrocution may lead to falls from tall heights. This possibility puts the person at risk for spinal and long bone fractures. Electrical burns often lead to damage below the surface of the skin and may not be fully appreciated on visual inspection. Chemical burns can lead to continual damage over 3 days. Myoglobin in the bloodstream from muscle damage puts the kidneys at risk for damage, and the patient is usually at risk for metabolic acidosis, not alkalosis. Which of the following is an insect vector-borne illness? A. Rocky Mountain spotted fever. B. Rabies. C. Roundworm. D. Cat scratch fever. E. Scabies. The answer is A. Rocky Mountain spotted fever. Insect vector-borne illnesses are given to humans through insects like ticks, mosquitoes, and chiggers. Rocky Mountain spotted fever is caused by Rickettsia rickettsii. Ticks are the most common vector for Rocky Mountain spotted fever. Prevention of tick bites is a crucial teaching point in preventing the spread of the disease. Although misleading, the infection can be obtained throughout the United States of America. Roundworm is caused by a fungus. Rabies is a viral disease that is typically transmitted between mammals through bites. Cat scratch fever is a bacterial infection that can cause severe neurological, musculoskeletal, circulatory, and other system damage in immunocompromised individuals. In healthy people, no treatment is necessary and the infection is fought. Scabies causes extreme itchy red bumps commonly in between the fingers, on the wrist, and around the abdomen. The organism that causes this disease is actually in the arachnid family and is not an insect. Ed is an 85-year-old male who lives at a long-term care facility. He has recently begun having difficulty brushing his teeth, an activity he would previously complete on his own. He has also appeared to be more confused while engaging in basic conversation with the nursing staff. The nurse should first evaluate Ed for which of the following? A. Alzheimer's disease. B. Bipolar disorder. C. Infection. D. Creutzfeldt-Jakob disease. E. Depression. The answer is C. Infection. Changes in baseline cognition and functioning of older adults may be due to infection. Urinary tract infections frequently cause confusion. Evaluate for an underlying condition before testing for rare diseases or dementia. A 3-year-old child is admitted to the pediatric medical unit from the emergency department with suspected rheumatic fever. Which of the following is not indicative of rheumatic fever? A. A red rash over his arms and legs. B. A temperature of 102 degrees Fahrenheit. C. A red rash over his chest and back. D. A history of sore throat 3 weeks ago. E. A negative titer for anti-streptyl isino. The answer is E. A negative titer for anti-streptyl isino. Rheumatic fever presents with a red rash over the trunk and extremities, fever, and a sore throat. It is caused by an untreated streptococcus infection in the previous 2 to 6 weeks, such as strep throat, and can be confirmed with a positive anti-streptyl isino titer. A nurse is teaching a 20-year-old male client newly diagnosed with herpes simplex virus, HSV, type 2. All of the following teaching points in regards to this condition should be included except which of these? A. HSV is a lifelong infection, with recurrent infections possible to the skin and mucous membranes. B. Certain factors may exacerbate the condition such as sunlight exposure, trauma, stress, or systemic infections. C. Transmission of the virus is possible by respiratory droplets. D. Recurrent episodes of HSV may exhibit grouped vesicles on an erythematous base. E. Nystatin is a common drug used to treat flare-ups of skin lesions associated with HSV. The answer is E. Nystatin is a common drug used to treat flare-ups of skin lesions associated with HSV. Nystatin is an antifungal medication, Not effective in treating viral infections such HSV. Antiviral medications such as acyclovir, famciclovir, and valacyclovir would be prescribed to control symptoms and shorten episodes. These drugs are not curative. 35-year-old male has just been admitted to the emergency department in a sickle cell crisis. The nurse caring for this client is aware of the signs and symptoms associated with this condition. The proper nursing management for this patient should include which of these? A. Strict bed rest and hyperbaric oxygen therapy for 2 hours. B. Blood transfusions and antibiotic prophylaxis. C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. D. Give platelets and monitor hemoglobin and hematocrit levels hourly. E. Heparin administration and iron replacement. The answer is C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. A sickle cell crisis will require interventions to control the client's pain due to widespread tissue ischemia. Oxygen is needed to treat hypoxia and control the amount of red blood cell sickling. Blood transfusions are usually not first-line treatment in a crisis. The SIRS, Systemic Inflammatory Response Syndrome, criteria includes which of the following? A. Respiratory rate greater than 30 breaths per minute. B. Heart rate less than 100 beats per minute. C. Temperature greater than 38 degrees centigrade. D. PCO2 45 to 55 millimeters of mercury. E. None of these. The answer is C. Temperature greater than 38 degrees centigrade. The SIRS criteria includes 4 factors. 1. Temperature greater than 38 degrees centigrade or less than 36 degrees centigrade. 2. A respiratory rate greater than 20, or PCO2 less than 32 millimeters of mercury. 3. Heart rate greater than 90 beats per minute. And 4. WBC greater than 12,000 per cubic millimeters, or WBC less than 4,000 per cubic millimeters, or immature neutrophils greater than 10% bands. To meet the SIRS definition must have 2 or more of these findings. The fact that an elementary school is shut down due to a measles outbreak is an example of an N-A. Epidemic. B. Sporadic disease. C. Pandemic. D. Endemic disease. The answer is A. Epidemic. The terms outbreak and epidemic are very similar, except an outbreak is confined to a smaller place. Both indicate an increase in incidence of disease. An endemic disease is always present in the community in a low level. An example is the common cold. A pandemic is an epidemic that occurs across multiple continents. A sporadic disease occurs randomly or in scattered incidents. Which of the following physical exam findings would you expect to find in a patient who overdosed on heroin? A. Shallow breathing, normal respiratory rate, dilated pupils. B. Deep breathing, low respiratory rate, dilated pupils. C. Shallow breathing, fast respiratory rate, pinpoint pupils. D. Shallow breathing, low respiratory rate, pinpoint pupils. E. Deep breathing, fast respiratory rate, dilated pupils. The answer is D. Shallow breathing, low respiratory rate, pinpoint pupils. Opiate, heroin, overdose is marked by a decreased respiratory drive, shallow breathing, and pinpoint pupils. Treatment is with naloxone and reverses overdose quickly. Heroin overdoses can be fatal if untreated because of the respiratory depression. A patient arrives to the ER in a comatose state. He is shallowly breathing, appears disheveled, and has pinpoint pupils. There are track marks on his right arm and it appears swollen. Which of the following conditions does this patient likely have? A. Opiate overdose. B. Benzodiazepine overdose. C. Alcohol overdose. D. Aspirin overdose. E. Anticholinergic overdose. The answer is A. Opiate overdose. This patient likely has opiate, heroin, overdose. Common signs of overdose include altered mental states, decreased respiratory rate and effort, and pinpoint pupils. Treatment includes inhalation of naltrexone to remove the opioids off their receptors in the body. Additionally, track marks are a sign that the patient injects heroin. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. If the organism identified in this patient's urine sample is Proteus mirabilis, which of the following would be the appropriate treatment? A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. B. A 14-day course of ampicillin or cephalexin. C. A 21-day course of ampicillin or cephalexin. D. A 10 to 21-day course of oral quinolone or trimethoprim, sulfamethoxazole. The answer is A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. The first-line treatment for uncomplicated urinary tract infection with Proteus mirabilis is a 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. 10 to 21-day courses are only appropriate in patients with complicated UTI or co-infections. Ampicillin and cephalexin are poor choices for initial treatment due to a 10 to 20% rate of resistance in Proteus species. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On urinalysis the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. This individual is most likely experiencing a urinary tract infection, UTI, due to which of the following organisms? A. Proteus mirabilis. B. Staphylococcus aureus. C. Escherichia coli. D. Staphylococcus saprophyticus. The answer is A. Proteus mirabilis. While all of the organisms listed are capable of causing UTIs, Staphylococcus species are all gram-positive. Escherichia coli, while responsible for 75 to 95% of all UTIs, would not result in a urinary pH of 9.5. The high alkalinity of this patient's urine suggests a urea-splitting bacteria such as Proteus. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis, a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. In the case of chronic Prochus mirabilis infection, which of the following is a common sequelae? A. Pelvic inflammatory disease, PID. B. Bladder cancer. C. Renal calculi. D. Infertility. The answer is C. Renal calculi. Due to its production of ureas, Prochus mirabilis infection results in alkalinization of urine, as ureas hydrolyzes urea to produce ammonia. This can cause the formation of calcium, struvite, or apatite crystals in the urine, which may form renal calculi. P. Mirabilis is not associated with increased risk for infertility, PID, or bladder cancer. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumotrax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. Pneumotrax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness.